What is the application of Roga Nidana principles in day-to-day practice? How to apply the Roga Nidana fundamentals in day-to-day clinical practice? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the fundamentals of application of the subject in day-to-day life, we need to know about the basic term, that is SNV of pathogen. It is the short form SNV. S refers to the source of entry of pathogen into the body. Number, that is N. N refers to the number of pathogens entering into the body. Third one, that is V, that is virulence of the pathogens entering into the body. All these three terms will be helpful in actually localizing the lesion. Which particular part of the body there is the disturbed functioning is happening. There is it happening in the alimentary canal, or there is it happening in any kind of the cellular level or intercellular level, etc., etc. We can able to localize if we know about these three terminologies, short forms in a detailed manner. When you think about the source of entry of pathogen, which is considered to be the first and foremost aspect, we know that in case of males, 9 natural orifices are there, whereas in case of females, 12 natural orifices are there. So here the almost 7 orifices are present in the head and neck region. Mouth, 2 nostrils, 2 eyes and 2 ears. 2 breast tissues are present in the chest region, and 3 natural orifices are present in the lower area, that is urethra, anus and vagina. When you think about the entry of pathogens, that may happen in the natural orifices, either it may happen in the one natural orifice, either it may happen in 2 natural orifices, or either it may happen in more than 2 natural orifices. We have to identify which particular part of the body, that is natural orifice, there is an entry of the pathogen is being taking place. And is it only related to the Bhashya Srotas? Is there any possibility of entry of pathogens happening in the Abhyantara Srotas? For example, if the pathogens are entering into the Pranavaha Srotas or Rasabaha Srotas or Raktabaha Srotas or Astivaha Srotas, in that way we have to analyze the entry of the pathogens taking place either in the Bhashya Srotas as well as Abhyantara Srotas. If we are able to accurately identify this, then the diagnosis of the disease will be very, very easy. So here, whenever if you think about the Abhyantara Srotas here, so there is the entry of the pathogens is going to take place. That is what we can see the Mahasrotas. There is every possibility that there may be a possibility of affliction of a Pranavaha Srotas. In that way, if the entry of the pathogen is taking place in the mouth, so the initial symptoms may be observed in the mouth and other surrounding structures. If the pathogens are entering into the nostrils, the first symptoms are saying the nostrils or the paranasal sinuses or the ears, etc., etc. In that way, we are going to identify the source of the entry of the pathogens, wherein we can able to localize the lesion as such, regarding the number of pathogens entering into the body. And the number of pathogens, in the sense, the what is the frequency of entry of the pathogens is that too in numbers is happening. So that has to be noted there. Whereas regarding the quantity of exposure, first example. So here only one samosa consumption, wherein we are going to expect the increase of pitta in a mild situation. Whereas in the second instance, the person is going to consume large amount of the samosa, that too with the green chutney, in the sense there will be more amount of the pitta dosha vitiation that may be possible. 1 kilometer of running may lead to vata prakopa, whereas 5 kilometers of running may lead to more amount of the vata prakopa. And hearing the music for 10 minutes may lead to vata vitiation. Hearing the music for 50 minutes, that may lead to more amount of the vata prakopa. Sexual intercourse once in a day may lead to milder vata prakopa. 3 times a day, that may lead to more vitiation of vata dosha may take place. In that way, the number of pathogens entry, so that will be deciding the the severity of the disease or diagnosis of the disease as such. Next, about the virulence of the pathogen. So virulence of the pathogen. So here, look into that. Only one samosa is being taken. They plainly, so that may lead to simple pitta prakopa there. Whereas samosa consumption along with the chutney, so that may lead to that more severe degree of pathogens that may take place. Whereas another major area where virulence of the pathogens that we may suspect there, that is the vaginal orifice. When you think about it, entry of the pathogens that may take place via oral cavity, that is oral cavity of the partner, that may help in the entry of the pathogens into the vaginal orifice. Second, that is the male sexual organ. That is another route where there may be a possibility of entry of the pathogens that are going to take place. Third, that is urethra in the female, which is situated anterior to the vagina, and the anal orifice, which is situated posterior to the vagina. All these are having the affinity of movement of the pathogens towards the vaginal orifice. So here, when you think about it, when the lady is exposed to the pathogens through the oral cavity, pathogens through the male sexual organ, pathogens via urethra or anal orifice, so here the virulence that will be much more severe, and the lady may develop very severe disease related to reproductive tract. So this is how the virulence of the pathogens that may help in deciding the degree or severity of the disease as such. And regarding the third example where we can give, that is cold substances exposure. So that is mainly related to the two major systems that may get dysfunctional, either initially or primarily gastrointestinal tract, and secondarily that is the respiratory tract. In that way, the virulence of the pathogens that are helpful in determining the severity of the disease as such. When you think about the application of the fundamentals of Roga Nidana, the first and foremost thing we can able to determine the disease afflicted at the earliest. In other words, early detection of the diseases that can be possible if we are applying the fundamentals of Roga Nidana. For example, the person is going to consume the samosa. So when you think about that, samosa is actually having the katu rasa, amla, lavana rasa as such. There may be a possibility of pitta dosha vitiation, which will be followed by vata dosha vitiation. As such, the dosha that may be afflicted could be rasa and rakta affliction may be predicted. As far as the Srotas is concerned, Pranavaha, Annavaha, Rasavaha, and Raktavaha Srotas affliction may be predicted. When you think about the contents of the samosa, Tikshna, Ushna Guna, that may get increased in the Mahasrotas. That too, that is alimentary canal. So depending upon the nature of the intake of samosa, depending upon the frequency of intake of samosa, so that we are going to predict the vitiation of either Vata Pitta Dosha vitiation or Pitta Vata vitiation. In this way, early detection of the diseases that can be understood by applying the fundamentals of Roga Nidana, understanding the root causes of the disease. For example, the person is having the burning sensation in the stomach region, and that he has developed after the nth day of samosa consumption. So here we are going to identify this may be the root cause for the development of this particular symptom. For this, we need to know about the fundamentals of Roga Nidana very clearly. Regarding the maintaining the healthy digestion. So if the person is having the habit of consumption of samosa frequently, which is considered to be unhealthy digestion, there will be the unhealthy digestion. Whereas maintaining the healthy digestion in the sense he has to have the balanced diet. In that particular situation only he can have the healthy digestion as such. Dietary regulation regarding how much amount of the food intake has to be taken. In a sense, is it full capacity of stomach? Is it 2/3 of the stomach? Is it 1/3 of the stomach? What should be the percentage of Shadrasa Yukta Ahara? How much amount of the Madhura Rasa should be taken? How much amount of the Amala Rasa should be taken? How much amount of the Lavana Rasa substances should be taken? How much amount of the Katu Rasa substances should be taken? How much amount of the Tikta Rasa substances should be taken? How much amount of the Kashaya Rasa substances should be taken? So in this way, we are going to understand, we are going to, what do you say, that they plan the ahara as such. How frequently one has to consume the food. Whether is it once in a day or twice in a day or thrice in a day or more than thrice in a day, he has to consume the food. That has to be, we can able to make out if we are knowing the fundamentals of Roga Nidana clearly. What precautions has to be taken? In the sense, what are the things, the rules and regulations or do's and don'ts the person has to follow whenever he is going to consume the food substances if you want to have the longer healthy life. So like that, the dietary regulation, if we are able to, we can able to make out if we know about the fundamentals of Roga Nidana clearly. Lifestyle management, in the sense we can able to manage the lifestyle of an individual. That is, what kind of the prakriti a person is having. Is it vata prakriti? Is it pitta prakriti? Or is it kapha prakriti? Or is it dvandava prakriti? Or is it sama prakriti? What pattern of the diet is being followed by an individual? Is it normal or is it abnormal? If it is normal, is it how to maintain the health of an individual? Is it abnormal? How to balance the diet? So that has to be that we can able to make out if we know about the fundamentals of Roga Nidana clearly. What is the regimen that is being followed? What is the pastime an individual is having? What is the rituals the person is having? Is it simply walking on the garden, or is it some kind of the goal-oriented activity a person is doing? That has to be known. What is the occupation of an individual? Is it physically challenging, or is it mentally distressing, or will it require more amount of the sedentary work as such? In that way, occupation of an individual, that counts a lot whenever if we are planning the lifestyle modification. What is the nature of sleep? Whether he is having the day nap, or whether he is considered to be a night owl variety, or when he is going to sleep. Is it in the early morning, some 2 or 3 a.m., or is it 10 a.m., or is it 8 a.m., or 8 p.m., etc. In that way, what is the time of sleeping? That will be helpful in determining the lifestyle. What is the timing of food intake? Whether he is going to consume the food at around 6 p.m. or whether he is going to consume the food around 11 or 11:30 p.m. That is helpful in determining the lifestyle there. Is it ideal to have the supper before 6 p.m. or after 9 p.m.? That will be helpful in what you say that the making the paternalizing of the lifestyle of an individual. What is the nature of the spending the time with the self, whether he is the watching the movies or listening to the music or reading the book, etc., or how he is spending the time with the family. He is considered to be a traveler a lot, or how he is going to have the time spending along with the colleagues, whether he is always having the quarrelsome attitude, or whether he is always having the superior attitude or inferior attitude. All they are helpful in determining the lifestyle of an individual. And this can be managed if you know about the fundamentals of Roga Nidana clearly. Seasonal disease prevention. Ayurveda says the person is suffering from tamakashwasa. The person is suffering from prakrita jvara, unmada, apasmara, atatvabhinivesha. So these are the different clinical conditions where we may suspect the possibility of a seasonal influence on the progression of the disease. So that means even this can be prevented if we are knowing about the exact nidanas which are responsible for the disease manifestations. Stress and mental health control. For example, here the person is going to consume the more amount of the samosa, in the sense the person will be having the physical stress, that too in the alimentary canal, where there will be more amount of the pitta dosha vitiation that may be possible. Whereas this example, the lady is going to, what do you say, that they consume the, what do you say, that they some kind of the drink, etc., while reading the book in the night time. We don't know at what time she is going to consume or they read the book or consume the drink as such. Is it around 12 or 1 a.m.? Definitely, which may indicate she is having some kind of the mental stress as such. In that way, if you know about the fundamentals of Roga Nidana, we can able to prevent these situations also. Prevention of the lifestyle diseases. That means we can able to analyze the exact Nidana which are responsible for the disease manifestations. For example, this example that is indicative of the Pitta dosha vitiation and Rasa Rakta dosha, Rakta dhatu affliction, Rasa Rakta vaha Srotas affliction, Prana vaha Anna vaha Srotas affliction, we may suspect there. Sangha and Vimarga Gamana may be the possibility there, and the person is having the Udbhavasthana as Amashaya, Sancharasthana as Mahasrotas, Rektasthana as Uras or Vaktra as such. In that way, we can able to analyze the, what do you say, that the diseases, and we can prevent the diseases also by preventing the or avoiding the food substances of this nature frequently. In that way, we can able to prevent the lifestyle diseases also. Improving the self-awareness. Suppose if the person is not habituated to stop the samosa, in that particular sense, he can reduce the samosa. How much to eat, whether is it once in a day or twice in a day? Why, which oil these samosa are being prepared? Is it in the sarshapa taila, or is it prepared in the groundnut oil, or is it prepared in the refined oil, or is it prepared by the fresh oil or previously used oil? Is it taken along with ice cream, or what are the things that should not be taken while consuming this, and at what time the water has to be consumed, whether is it before the consumption of these or after the consumption of these, and whether it has to be taken along with the tea or ice cream, or the samosa can be taken at around 9 p.m. or in the 10 a.m., etc., etc. So these informations that will be helpful in expanding one's awareness regarding the self, promoting the preventive measures. In a sense, if the person is having the consumption of these substances, the ideally the prevention of the diseases can be done by less consumption of these substances. Thereby, we can able to plan the proper diet and regimen, and we can even able to plan the balanced diet so that we can have the prevention of such kind of the, what do you say, that the diseases we can be prevented. All these are possible if we are knowing the fundamentals of Roga Nidana accurately. To sum up, the SNV, that is source of the entry of the pathogen into the body, number of pathogens entering into the body, virulence of the pathogens entering into the body, leading to the disease manifestation, they are very, very important whenever if you are planning the accurate analysis of the disease as such. When you think about this, there are 10 basic points wherein we can able to apply the fundamentals of Roga Nidana in day-to-day practice. That is early detection of the disease, identifying the root causes of the disease, maintaining the healthy digestion, dietary regulation, lifestyle management, seasonal disease prevention, stress and mental health control, prevention of the lifestyle diseases, improving the self-awareness, and promoting the preventive measures. When you think about this, it is being mentioned in Ayurveda, Sankshepatāh Kriya Yogo Nidana Parivarjana. So the first and foremost line of treatment is Nidana Parivarjana. And this particular Nidana Parivarjana is possible if we are in a better position to localize the lesion accurately. Thereby we can able to think about the accurate Nidana that is responsible for the disease manifestation. Dear ANA community, what are the major key takeaways of this discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.